First of all, I'm going to tell you the importance that a phrase make me feel about the World Health Organization Directors General, Dr. Tedros Adhanom, that he say we cannot say this loudly enough or clearly enough or often enough. All countries can still change the course of this pandemic. And that informs me the importance about this virus. COVID-19 is an infectious disease caused by the recently found virus known as COVID coronavirus. Before the outbreak originated in Wuhan, China in December 2019, there was no information about this virus. I found that the history was so long, so I make a resume about it. And the oldest common ancestors of coronavirus has been dated as far as back as the 9th century BC. Some studies published in 1990 specify the most recent common ancestors as follows: beta coronavirus, delta coronavirus, gamma coronavirus, alpha coronavirus. I am going to let you know about the principal symptoms that this disease causes you. Tiredness. The body feels completely tired without energy. High fever. The body temperature can exceed 37.3 Celsius degrees. Dry cough. Constant coughing without spelling any mucus. Difficulty breathing. Breathing actually feels more difficult. But your question is, what is and what we should know about coronavirus? How it is spread in people and in surfaces. First of all, in people, this disease can spread from person to person through small droplets from the nose or the mouth when the infected person coughs or exhales. And in surfaces, these small droplets land on surfaces, which means any person that touches these surfaces and then their eyes, nose, or mouth can become infected. If there is a virus that infects people, it exists asymptomatic ones. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mild cough and does not feel ill. By the other hand, I am going to inform you about the 5 important steps you need to follow if you have the mentioned symptoms. The first one, you have symptoms or have been in an infected area. Step 2, call the assigned phone number for your region. Step 3, you will be given a home test over the phone. Step 4, patiently wait for the results of the test. And in step 5, follow the instructions provided by the doctors. If he says stay at home, you need to stay at home. As I lovely say, today for you, tomorrow for me. In this part of the presentation, you are going to know about the stats about coronavirus. As I am showing you here, these stats are actually from this month, so you can clearly see the mortality rate of by age of the coronavirus is expanding us and is causing this virus. Here you can see the map where the virus has spread around the world and the confirmed cases are in red. And in this final part, you can see that you are going to take in consideration the preventive measures. Here you can find the importance of protecting yourself and preventing spread the disease. The first step is wash your hands with an alcohol-based sanitizer or with soap and water. The second one, keep a distance of at least 1 meter between yourself and anyone who coughs or sneezes. Try your best not to touch your eyes, nose, and mouth. Cover your mouth and your nose with your bent elbow or a tissue when cough. Seek medical attention if you have difficulty breathing and a high fever. Follow the directions of your national or local health authorizes. In this part, you can see the protective measures. And for people that are visiting or infected areas. Stay at home, do not if you not feel well, even if you feel mild symptoms such as headache, sleep fever, and a runny nose. If you need to go out, for example, to buy food or supplies, wear a mask to minimize the risk of infectious areas. If you have difficulty breathing or in a high fever, seek medical advice as soon as possible. Call your provider and inform them of any recent travel, especially to countries with reported cases, as I mentioned before in the map. Finally, you can see how to use a mask and the importance of it in this pandemic situation. Before wearing a mask, wash your hands with an alcohol base. Cover your mouth and nose with a mask and make sure the mask is firm pressed against your face. Do not touch the mask while you're wearing it. Replace the mask as soon as it gets wet and do not reuse it. As I repeatedly say, do not reuse it. Remove the mask from behind, do not touch it, its front sides. Throw it away in a closed container and then wash your hands with an alcohol base disinfectant or with a soap and water. I already put on your mask, and you?